So for my genetic disease, I researched hemophilia, which is a mutation on the X chromosome, which causes abnormal bleeding. It affects all racial and ethnic groups, but it is more common than males and females. This is because, since it's carried on the X chromosome, males have one X chromosome and females have a second, so their second X chromosome can kind of act as a backup. They can still be carriers, though. It's found in about 1 out of every 5,000 male births, and the actual mutation itself, its location, depends on the type of hemophilia that you're dealing with. Symptoms can include joint pain, stiffness, and swelling due to bleeding between the joints. This causes joint damage, easy bruising, of course, and excess bleeding that's really hard to stop. It's very commonly seen at bleeding after circumcision in young boys. Since it's more common in boys, that's really common. So screening tests show if the blood is clotting properly, and then if it's not clotting properly, they go on to a clotting factor test, which diagnoses hemophilia and its severity along with other blood disorders. With treatment and education, patients with hemophilia can typically live a normal and healthy life, but that depends on the severity and the form of hemophilia. Treatment for it. The best course of treatment is to replace the missing clotting factor from the blood. This is done by infusions with manufactured factor concentrates regularly. And in a current research study done at Wake Forest School of Medicine, they did an animal study and injected bone marrow stem cells from the father of the subjects. And in 2 of their treated animals, the stem cells migrated to the joints, and they reversed the joint damage there, and it also ceased the spontaneous bleeding.